watching DD News and I'm Preeti presenting Tracking COVID-19, a special half-hour show we get for you each day that apprises you with all the developments on the pandemic. We also get you inputs from our reporters, international and global aspects, and also expert advice by the doctors on how to keep yourself safe. The nation yesterday came together with an overwhelming response to Prime Minister Modi's call to light candles and diyas to express solidarity in the fight against COVID-19. We get you the details of this and more. First, we begin with a quick roundup. Cabinet Secretary reviews COVID-19 situation with top officials of the state government. As on date, a total of 274 districts have been affected by COVID-19 in the country. Number of active cases in India rises to 3,666 with 291 recoveries and 109 deaths. Prime Minister Narendra Modi speaks to leaders including former Prime Minister Dr. Manmohan Singh, Congress Chief Sonia Gandhi and former President Pranab Mukherjee on COVID-19. Prime Minister Modi calls out West Bengal Chief Minister Mamata Banerjee, Odisha Chief Minister Naveen Patnaik, DMK's M.K. Stalin and Shiromani Akali Dal leader Prakash Singh Badal. Countries world over continue to face coronavirus crisis as confirmed cases crossed 12,70,000. Over 69,000 deaths reported with United States worst hit. British Prime Minister Boris Johnson taken to hospital for further tests after testing positive for COVID-19. These were the headlines. Up next, we get you updates in Ground Zero. The active cases of COVID-19 in the country have risen to 3,666, while 109 deaths have been reported across the country. 291 people have recovered from the infection and have been discharged from the hospitals. Ministry of Health and Family Welfare, in its daily briefing, said that the main reason for the rise in overall numbers continues to be the Marcus cluster. The number of COVID-19 cases has doubled due to the Marcus. Cabinet Secretary has taken stock of the situation. And briefing the media, Joint Secretary, Ministry of Health and Family Welfare, Love Agrawal, said that the Cabinet Secretary held a meeting with district magistrates, superintendents of police, chief medical officers and top officials of state governments through video conferencing. Cabinet Secretary Rajiv Gaba has instructed the district level officials to ensure that the units making medicines and equipments continue to operate uninterruptedly. The Health Ministry in its briefing said that the emphasis has been laid on ensuring adequate supply of oxygen cylinders. Social distancing and lockdown continue to be the key COVID-19 vaccines as there is no vaccine as such. It has been highlighted that spitting at public places can aid the spread of coronavirus. There are 14,522 self-help groups working on mass production of the masks. Domestic production of personal protective equipment has started. The Ministry of Home Affairs has said that food and medicine supplies are being sent across the country. The state governments have been following the guidelines under the lockdown. The situation of essential goods and services is satisfactory. There are 28,000 relief camps set up across the country. 12.5 lakh people are in shelters across the country. The government is monitoring the cost of essential supplies. Railways is helping in transport of essential goods. Now, there is no bar on interstate cargo movement in the country. In the daily briefing, ICMR scientist Dr. R. Ganga Khetkar has said that COVID-19 is only spreading through droplets. ICMR has no evidence of the virus being airborne yet. Rapid antibody tests will be done from Wednesday and the rapid test kits will be used in areas with higher percentage of the cases. According to sources, Prime Minister Modi on Sunday called two former presidents, Pranab Mukherjee and Pratibha Patil and had a discussion on COVID-19 related issues. He also spoke to two former Prime Ministers, Dr. Manmohan Singh and H.D. Deve Gowda, to discuss COVID-19. Prime Minister also called up leaders of various political parties like Sonia Gandhi, Mulayam Singh Yadav, Akhilesh Yadav, Mamta Banerjee, Naveen Patnaik, M.K. Stalin and Prakash Singh Badal. And open markets have been started and opened by civic society Navi Mumbai to decrease congestion while selling and buying essential items. Similar scenes were being witnessed in other parts of Maharashtra, thus ensuring social distancing. Police officials have also been deployed to ensure strict adherence of the precautions. We get to more in this report filed by our correspondent Yogesh Sheetal from Ground Zero.
Some of the wholesale market, retail market and also main roadside markets have been shifted to an open ground, and there are many such grounds in Mumbai, Navi Mumbai and also adjoining areas like Thane, like Kalyan and Dombivali. One such market here you can see behind me. This is one such market where I am standing right now in Navi Mumbai. You can see this is an open market, and the civic body has ensured that people get more space to ensure social distancing, because earlier the entire market was shifted on the roadside, and that's the reason why the entire the area, the market was very congested. But now, since people have more space, vendors have more space, buyers have more space, so it also ensures that people don't get get close to each other, and that is the main purpose of social distancing, which is considered as one of the main cure of COVID-19. So this is the scene of Navi Mumbai, and the same scenario you can see in different parts of Maharashtra as well, just to ensure social distancing. Also, one important thing at this point in time, you can see there are some vehicles there. The vehicles belong to municipal corporations, and the staffs are there. They are monitoring that whether people are following the instructions or not. No doubt the people are coming. You can see the ladies and the gents. The people are coming here to buy vegetables, to buy fruits, and to buy milks also at that corner. So people are here to get their daily needs, and also since the fruits and vegetables and entire these items are under essential services, so there's no problem in the supply. In the vehicles, they are just moving around from local areas. The vegetables are transported to these open grounds. So the situations on the ground are not very bad in terms of food supply, in terms of food chain, and also people are cooperating. You can see some people are just having mask on their mouth, and some ladies are having dupatta and saris to cover their mouth, to ensure that they are facing to ensure that the virus is not transmitted to them. So in fact, the situations is, as far as essential services are concerned, are good in Mumbai, in Navi Mumbai and adjoining areas, and also other pockets in Maharashtra. For Doordarshan News, this is Yogesh Kumar Sidal from Maharashtra.
So that was our reporter joining us from Maharashtra. Up next, we'll go across to Rajasthan with Jaisalmer and Nagaur. The coronavirus infection has spread to 21 districts in Rajasthan. Total number has crossed 260 mark. In Jaipur, 39 positive cases were found in the walled city area of Ramganj. One canteen assistant at the SMS Medical College from Ramganj was also found positive. Fear looms large on the resident doctors of the largest hospital in the state. We get to more in this report filed by our correspondent Vishal Baristo from Ground Zero.
To control the spread of coronavirus in Rajasthan, the state government is now focusing on the ICMR approved rapid testing strategy. Screening and contact tracing is already being done. Bhilwara is under control, but now the new challenge comes from Ramganj in the walled city. And the government is now planning to adopt Bhilwara model on Ramganj. 25,000 doctors and nurses are already there in the field. The government has also asked private hospitals at the district level to be prepared with 100-bed quarantine. But the important thing is that we should follow the norms of the lockdown so that we all are safe and secure. Vishal Baristo for DD India.
And our correspondent Vishal Baristo is joining us from Jaipur with more details. Vishal, in your report, we told our viewers about the active cases there in Jaipur. More than around 260 cases have been reported. Let us know more details, the latest update on the cases first.
Very good morning to you, Preeti. Yes, the cases have gone up. Now it is the 274, and it's a major concern for the authorities, especially coming from Ramganj, and also all those people who have come in contact or attended the Tablighi Jamaat event in Delhi. As far as Ramganj is concerned, it is now the epicenter of Rajasthan coronavirus infection, and like Bhilwara was put under control after a war footing, after efforts were made on war footing. The same model is being introduced now in Ramganj. Let me tell you that 50 teams have been deployed in Ramganj, and each team includes a doctor, A&M, and nursing staff. That amounts to 5 per team. So around 200 medical people are already there in Ramganj. But let me tell you that it is very bad to hear that when people are there to support you, to help you medically, to treat you, you mistreat with them. And there are reports coming from Ramganj that medical teams have been attacked or resisted with. So this is a very bad situation there, and the government is looking into the matter. Along with that, spitting in public is a big problem. It's a huge problem. There is a huge challenge there. Ramganj is a very congested place, a very congested locality, and hygiene is a major concern for the authorities. So definitely, Ramganj is now the focus in Rajasthan. Preeti?
All right, Ramganj is the focus in Rajasthan, but also let us know more details as to how are people on their levels coping up with the pandemic there in Rajasthan. Vishal?
Preeti, let me tell you that the government has asked district private hospitals at the district levels. In fact, they have already been identified, and they've been asked to be prepared for 100-bed quarantine within 2 hours. And 80 such hospitals are there in Jaipur. These are private hospitals. Meanwhile, Savai Mansingh Hospital is the largest hospital in Rajasthan, and along with that, NGOs have also come forward. They are helping our people with the basic needs, especially the food and other things of need, like the disinfectants and all. The daily wagers who are now stuck because of the lockdown, who cannot move, they have been taken care of by the government authorities. There have been different shelters that have been prepared by the government and also by the NGOs. So local people are also trying to step in and put in their effort as far as this war against coronavirus is concerned. But let me tell you that unless we support and help and cooperate with the medical teams and medical authorities, and whatever steps the government is taking, the authorities are taking, it is going to be a bit more difficult. So we need to stay indoors, social disconnect and emotional connect, as the Prime Minister said. We need to follow those norms, and at the same time,
Yes.
hygiene is a big issue. We have to follow those norms because it is now an established fact that it is not an airborne disease, but at the same time, you have to be very careful of the droplets, because it spreads with the droplets. So spitting in public is a big no, and we need all to follow it, and especially when it comes to a congested locality, it is very dangerous. Preeti?
Yes, on our part, we have to do our bit to ensure that we help the government in keeping this pandemic at bay. Vishal, also let us know more details about the availability of the essential commodities. Are people facing any difficulties in meeting their day-to-day needs, consumption needs in Rajasthan?
Well, absolutely. There is no dearth of any essential commodities as far as milk, food, and vegetables are concerned. Let me also tell you that though the wall city is locked down, Ramganj is one of the localities, and there are 7 police stations which fall under it, and now it is sealed. No vehicle is allowed inside. It is, if in case any vehicle has to come out or go inside, it is first sanitized at the entrance, because walled city, when the city was constructed in the 18th century by Savai Singh, this walled city was meant to protect the city from outer attack from outside. But now it is an attack from inside, and the authorities do not want that this should spread to other parts of the city as well. So all the basic things like milk, vegetables, and fruits, they are being provided inside the walled city, and it is being done in such a way that the hygiene and sanitation is maintained. So the vehicles that carry food, fruits and veggies, they first reach to the gate, From there on, it is carried and transported in a different vehicle, which is already sanitized by the authorities, and then home to home delivery is being organized and arranged by the authorities. But again and again, the authorities are telling people to respect and follow the norms of the lockdown for the safety of themselves and for the safety of the country. Preeti?
Yes, the people need to adhere to the lockdown. Vishal, we'll go back to the cases which are seen in Ramganj. Let us know more as to what are the difficulties, the challenges which the authorities there are facing while keeping a check on the cases related to the pandemic, because when we talk of the lockdown, this is willful adherence which has to be followed by the citizens. But again, we see stray incidents of carelessness have been coming to light, be it Nizamuddin, or for that matter, be it how people have been hiding their travel histories and how they're not coming out in open and admitting that they have symptoms of the pandemic. So put all this together, let us know how difficult is it for the authorities to keep a check on the cases there in Rajasthan. Vishal?
Well, certainly you said very rightly, because this callous attitude cannot be ignored and cannot be allowed to be ignored, because you have to be very, very careful. It all started off with one person who had a travel history in the Middle East, and he came back with an infection, and then he had a party at his home, relatives and house members of the family attending that party, and slowly that has spread to the whole locality. And now we get to know that one of the person who was serving in the SMS Medical College canteen was also found positive. So definitely it's a matter of big concern. You have to be very watchful, you have to be very much aware, and you have to be always watchful of the hygiene situation, because the government cannot be running around after each and every person with the sanitizers or with the mask. Yes, they have to provide, they have to supply, but then you have to maintain all these things on your own. You have to have that sanitization in your house. You have to maintain all the disinfectants. Of course, it is being provided by the authorities, but at the same time and again, I would say that it is a big challenge as far as congested localities are concerned. And there are still incidents in Ramganj where people do come out of their houses, they are spitting in the open. Now that's a huge challenge, and the authorities have to work out some kind of plan, because they have to keep them indoors and ask them to maintain the hygiene level, because you cannot allow this situation to go out of hands. And yesterday itself, 39 cases were reported by night, and also more and more positive cases are coming from Ramganj. Definitely is a big concern for the Rajasthan government and for the medical authorities here in the state.
All right, yes, it is indeed a concern for the authorities there, but again, the crux of the entire situation is that we as individuals need to be careful. We need to practice social distancing and also practice isolation and keep ourselves hygienic and clean, and that is the only way through which we can ensure that the threat of the pandemic is kept at bay in the country, and that only would give a fillip to all the measures and all the efforts that are being made by the government. So that was our correspondent Vishal Baristow joining us from Jaipur, getting us more on the current scenario in Rajasthan. Let's move on to our next segment. We know every dark cloud has a silver lining. In these times of distress, when the world is bracing each day to fight this pandemic, we get you some good positive reports in our good news segment every day, which show that humanity and hope still live on and keep the world going in these distressing times. The Disinfection Tunnel has been installed at the entrance of Agricultural Produce Market Committee in Hubli district of Karnataka. The tunnel sprays people with small percentage of sodium hypochlorite solution through nozzles before they enter the market. Setting up of this tunnel can help curtail the spread of coronavirus by disinfecting the bacteria of the body. On a successful trial, such tunnels will be installed at other places across the state.
Because of we have to face the corona infection, for that purpose it is helpful for all the farmers, vegetable vendors and other people who are coming and going there in the APMC Hubli. It is for the purpose of their good health and anti that virano. This is useful.
Then 1% of sodium hypochlorite solution. Now today we have done up to 0.8% of sodium hypochlorite solution in 1000 liters of water. So this water is pumped through the high pressure pump through the nozzles. So it sprays like a mist, like a fog. The idea behind this, we did not put the large sprinklers, is people might get wet and that might cause more allergy and all the problems. So this just sprays on the body surface area, and there are least side effects when we looked into the literature. Usually the allergy or any forms of rashes or adverse effect due to sodium hypochlorite is usually obtained if there is a long exposure period. But here the exposure time is just 3 to 5 seconds, which is very less for anybody to cause allergy.
Police in Mahuwa Taluka of Surat district of Gujarat are stopping the pedestrians to urge them to stay home during the lockdown period. Coronavirus themed helmet has become the trend for the police officials to spread awareness and projecting a message that lockdown means staying at home and only move out during an emergency or if necessary. Police officers are seen wearing a red helmet dotted with long red spikes with rounded ends. Cricketers and Bollywood stars have appealed to people to support the government's efforts in fighting COVID-19 and obey the lockdown rules.
These are very testing times in our lives, but we will fight it. Listen to what every state government says, listen to what every health department says, listen to the directives of the central government. As they say, it's important to stay at home. Isolation is very, very important. Be safe and be healthy, and most importantly, be sensible.
All those who are watching this video, to observe a few things. Please maintain personal hygiene. Please avoid gathering in places, because that is where the virus can spread and you might also catch it unknown to you. Please avoid unnecessary travel.
It must have been very tough for Prime Minister Narendra Modi ji to take this extreme decision of lockdown. Let's follow our leaders. Let's follow rules, stay home, stay safe, and of course, stay healthy.
मैं हूँ सलमान और ये है
निर्वाण।
हम लोग यहाँ पर आए थे कुछ दिनों के लिए, अब हम यहीं पर हैं। तो हम लोग तो भाई डर गए, करेक्ट। तो निर्वाण सोहेल के साहबजादे हैं, सोहेल के बेटे हैं। इन्होंने अपने फादर को कब से नहीं देखा?
3 हफ्ते तो हो गए।
मैंने अपने फादर को 3 हफ्ते से नहीं देखा, क्योंकि हम लोग यहाँ पर हैं, हमारे फादर अकेले घर पर है। यू रिमेंबर द डायलॉग, जो डर गया समझो मर गया? वो यहाँ पर अप्लाई नहीं करता। हम लोग डर गए और बड़ी बहादुरी से कह रहे हैं कि हम लोग डर गए। आप ज्यादा ब्रेव मत बनो, क्योंकि इसमें do you think any point in being brave in this?
No, I think it's better for everyone to stay home, avoid contact, and I think the longer we stay indoors, the faster this ends.
जी, तो जो डायलॉग था, जो डर गया समझो मर गया, वो यहाँ पर अप्लाई नहीं करता है। जो डर गया समझो बच गया, और उसने बहुत सारे लोगों को बचाया भी। थैंक यू। मॉरल ऑफ द स्टोरी कि हम डर गए थे।
Alright, so जो डर गया वो बच गया, and the moral of the story is to ensure that you stay at home, keep yourself isolated and maintain personal hygiene. Up next, we get you World Wrap, where we tell you how the rest of the world is coping with this pandemic. Coronavirus continues its spread across the world as the total positive cases around the globe reaches 1 lakh, rather more than that, 12,74,923, while 69,478 deaths have been reported globally. 2,39,900 people have recovered from this pandemic. United States enters one of the most critical weeks so far in the coronavirus crisis, with the death toll exploding in New York, Michigan and Louisiana. New York, the hardest hit state, reported on Sunday that for the first time in a week, deaths had fallen slightly from the day before, but there were still nearly 600 new fatalities and more than 7,300 new cases. Places such as Pennsylvania, Colorado and Washington DC are starting to see rising deaths. Across the US, more than 331,151 people have been infected and over 9,420 have died till now. Amidst the scare, some good news has come in from Europe, which saw further signs of hope in the coronavirus outbreak yesterday. Italy's daily death toll was recorded at its lowest in more than 2 weeks, and its infection curve was finally on a downward slope. As it enters the 5th week under lockdown, Italy now has a total of 15,887 deaths and nearly 1,29,000 confirmed COVID-19 cases. It has the world's highest death toll from COVID-19 disease and also recorded 4,316 new cases yesterday. In Spain too, the confirmed new virus deaths dropped for the 3rd straight day yesterday to 674, the first time daily deaths have fallen below 800 in the past week. 6,023 new confirmed infections were announced yesterday, taking its national tally to 1,30,759, but down from an increase of 7,026 infections in the previous day. While total deaths were now 12,418, this is the highest in the world after Italy. Amidst the slight fall, Prime Minister expressed hope by saying that we are starting to see the light at the end of the tunnel. But the optimism was tempered by Britain's jump in virus deaths that outpaced the daily toll in Italy. Even Prime Minister Boris Johnson has not been left untouched. He was admitted to hospital for tests yesterday after showing persistent symptoms of the virus 10 days after testing positive for it. Downing Street said that it was a precautionary step and he remains in charge of the government. Till now, almost 48,000 people have been confirmed to have COVID-19 and 4,934 have died. Next is our segment Doctors Speak, where we tell you facts related to COVID-19 coming directly from our doctors.
नया